So I volunteer here at Addenbrooke's as a physiotherapy volunteer with Poppy, and we come here every Tuesday and we specialise with the paediatric team and particularly the paediatric physiotherapy team.
Jack and I have been volunteering at Addenbrooke's for about 5 years now, since he was 2.
So I decided to become a volunteer. I saw an advert in the paper, a news article. There was a physiotherapy dog that was also a Labradoodle, and I looked and thought actually Poppy would be fantastic at this because she's so calm and relaxed.
I decided to become a PAT volunteer because my daughter was working here at Addenbrooke's on one of the wards, and she described how the atmosphere changed when the PAT dogs came onto the ward, and she came home and said, "Dad, you've got to do it."
During our physio sessions with the PAT dogs, we tend to get them involved in any way we can to support pushing the patient towards their kind of goals in physiotherapy. So we might get them involved in helping the child reach more when they're doing some stroking. We might get them using the lead to walk with the dogs as well. So sitting-based activities up to standing, and we also do some throwing activities with Poppy on the lead as well to try and encourage the use of their upper limb but also their trunk and core.
I think it's just a really amazing, privileged opportunity to be able to go onto the wards and to put smiles on young people's faces.
I enjoy seeing Jack greeting the patients and their reaction when he goes up and says hello. And he loves going onto the outpatients areas because he can go around and make a fuss of people and they make a fuss of him.
So from a clinical perspective, with the PAT dogs working in our physiotherapy sessions, we found that the children are much more motivated to engage. They absolutely love the sessions. They tend to push themselves harder, which families have fed back to us as well. And we find that they're achieving their goals quicker, which for us is great because it means that they're getting to where they want to be. They're having more fun in the sessions. They're more motivated. And I think we're kind of pushing towards maybe getting earlier discharges from that perspective as well, because they're getting to where they need to be sooner to go home.
The greatest thing is particularly when you're working with patients where you see them week in, week out, that you see their progression over the weeks, which is amazing.